AI tools such as NeuroQuant really help level the playing field.
Is this raising a flag for something, or is it completely normal? NeuroQuant eliminates that subjectivity.
It adds additional information. For NeuroQuant dementia in particular, it's the neurologists that really want that quantitative information.
I think it's very, very beneficial with this AI tool.
I've been using it in my clinical practice now for almost 20 years. My referrers have really found great value in it. The neurologists tend to order it for almost every patient that has memory loss. They find it absolutely essential for their MS patients because they use the volume of plaques and the change since the prior study to make disease-modifying therapy decisions, and they've just come to rely on it. Very crucial information for the neurologists to know. They rely very heavily on these reports.
At my institution, all of the neurologists, be it the epilepsy specialists or the cognitive neurologists focusing on dementia patients, really take the time to review the scans of their patients, and having a NeuroQuant report available has become the expectation and the norm.
For the most part, as radiologists, we will kind of quickly look at the hippocampi, look at the amount of atrophy. We give it a sort of a qualitative rating of is there mild atrophy, is there moderate atrophy, and you kind of have to adjust that on the fly in your head based on how old the patient is and kind of get a sense. But that's really very qualitative. It's nice to be able to have a sort of a more precise quantitative metric of whether there is atrophy relative to that patient's age and gender. It adds additional information. For NeuroQuant dementia in particular, it's the neurologists that really want that quantitative information. They kind of combine it with the more clinical history and laboratory values to come up with their diagnosis.
For someone who is in the neuroradiology practice, I think this AI tool is really impactful, really efficient, and very, very useful because the NeuroQuant gives you a very quantitative results that enhance our interpretation in brain MRI. So I can easily discuss with the clinician about that.
So a lot of times if I'm looking at a brain and I'm thinking that there's moderate cerebral atrophy, but with a mesiotemporal predilection and not really what you would expect for someone at such a young age, and then my colleague might read a study a month later for some other indication, and they say the brain volume looks normal for age, the neurologist doesn't know what to think. Is this raising a flag for something, or is it completely normal? Again, NeuroQuant eliminates that subjectivity.
We always review the NeuroQuant reports at our multidisciplinary conferences. We have many active discussions about the results and the reports, and I have always thought that they add an objective facet to the radiology interpretation, thereby improving patient care.
In some cases, if there is a subtle atrophic changes in the brain parenchyma, we can easily miss it. So this is totally normal, especially in the early onset dementia or early stage dementia patients. But now I can easily interpret the NeuroQuant results, so I can easily say, yeah, this patient has some hippocampal atrophy because it's below 50%. I think it's very, very beneficial with this AI tool.
For the radiologist, the hippocampal volumes, the lateral ventricle volumes, and the inferior lateral ventricle volumes, and then also has the hippocampal occupancy score. Combines the hippocampal size and the inferior lateral ventricles to give you more of a sense of how much volume has been lost overall and how much the ventricles are expanded. And they're also excited to use the seizure asymmetry tool. They do really like it, and they enjoy having a better communication with radiologists to make sure that we're reporting the way that they coming to a conclusion that they also agree with.
When we were considering various AI tools for integration into clinical practice, we immediately focused on Cortex since it is such a key and well-established player in the field. We look towards the future. We are really looking forward to integrating the tools and make sure that all of our patients across the country get the high-level patient care that they deserve.